professor, physician, epidemiologist. I am Dr. Sri Banerjee. Trusted evidence, informed decisions, better health. This is the motto for Cochrane and their website. Hi, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. Getting information that is reliable and trustworthy has become somewhat of a challenge, especially in recent years. Many places have reported on the perils of having the infodemic. So it's the twindemic of the pandemic and a whole deluge of information. And this spread of misinformation and how to prevent this, I think, is really accurately depicted in this picture, where a flood of just a flood of water is coming out of the phone, and that's at many times how we feel, and we're trying to snorkel through all of the information that is out there. So this report, the Cochrane convenes report, this quickly goes into just all the things that we've learned from the pandemic, the response, how do we grapple with future global health emergencies and crises. There's a call to action, which you can kind of view and take a look at. There's a lot of different things that recommendations that's there, and so I encourage you to go through some of that as well. Additionally, there's some really insightful case studies and examples of how interventions can be studied in various disciplines. What I mean by various disciplines, I'm not saying like disciplines like criminology or education, more specifically the health discipline. And so, for instance, gum disease. Does treatment for gum disease help people with diabetes control? That's an intervention, an interesting it's a type of question. So if you can measure and assess for gum disease, periodontal disease, and compare the intervention group where which the disease is being addressed, and then a group where it's not, then you can see if the answer to that question. Similarly, digital technologies to help people with asthma take their medication. So one important issue with asthma control especially is that there are quite a few different types of medications. There's steroids, there's rescue medicines, and all sorts of things that require kind of knowledge and accurate administration. Technology is helping do that, so much so that there's actually a 15% increase in compliance in medication for those that are using technology-guided medication administration versus those that are not. So these sort of intervention comparison group studies, they can be important and quite informative. But what is key in each of these scenarios is that you have to know enough about the disease condition. It's not enough just to know about diabetes. It's not enough just to know about asthma. You have to know what is going on. Another one, fecal blood test is more accurate in detecting bowel cancer and large polyps. So there's comparisons of fecal blood tests versus other types of studies, other types of assessments. So what are the different types of tests? Immunochemical tests that are in there, There's actually two types of fecal blood tests. So the immunochemical tests, and then the GAIAC-based fecal ocal blood test. And so the comparison of these two types of fecal ocal blood tests provides better insights as to how to better screen colon cancer. So I've already given you, and I encourage you to go through all of these, but I've already given you 3 scenarios where intervention studies, specific informed intervention studies, can better guide and provide insights about disease conditions and really improve your public health research question and the types of specific research questions that you're asking. So this is another technique and another website, another resource tool that you can use to narrow down the research topic that you're interested in and that you would like to study. Thank you for listening.